Welcome to this month's CNA Monthly In-Service for the month of June. This month we will be discussing common infections, what to look for, and preventative measures we can take as caregivers. Infections of the eye. Eye infections are pretty common. An eye infection is a disease of the eye caused by microorganisms such as bacteria, viruses, or fungi. Infections in the eye can show up in many different ways. A lot of it depends on which part of the eye has the problem. Common types of eye infections include pink eye or conjunctivitis. It's an infection of your conjunctiva and usually gives your eyes a pink tint. It can be caused by a bacteria or virus, although sometimes you might get it from an allergic reaction or irritants. It's common to get pink eye when you have a cold. In adults, it is most commonly caused by a virus, and in children, it is most likely bacterial. The next type is keratitis. This is an inflammation of your cornea that can be caused by bacteria, viruses, or parasites in water. It is a common problem for people who wear contact lenses. Another type of infection is a stye. This usually starts out as a painful red bump under the eyelid or at the base of the eyelashes. You get them when the oil glands in your eyelid or eyelashes get infected with bacteria. These are similar to a pimple. Blepharitis is a chronic eye condition that causes inflammation and irritation of the eyelids. It can cause redness and crusting. You can get an eye infection in any part of the eye. This includes the eyelid, cornea, conjunctiva, which is the thin area that covers the inside of the eyelid, and outer white part of the eye, as well as other parts. There are several symptoms of eye infections to be aware of. Some of those include pain or discomfort, red eyes, itching, eye sensitive to bright light, watery eyes, blurred vision, drainage, maybe yellow in color, burning or irritation of the eye, small painful lump under the eyelid or eyelash, and sensitivity to touch. So remember, if you suspect any of these symptoms, be sure to fill out an observation report, notify the nurse, make a notation in the residential logbook. Never assume it's just allergies. These are just a few ways to prevent eye infections. Wear protective eye gear. Avoid allergens that bother your eyes. Don't touch your eyes or face with dirty hands. Don't share eye and face makeup with anyone. Use a clean towel and tissue on the eyes. Wash from the inner part of the eye to the outer part. And wash bed sheets and pillowcases at least once a week. Another common infection we should pay attention to while providing personal care are urinary tract infections, or better known as UTIs. A UTI is an infection in any part of the urinary system. The urinary system includes the kidneys, bladder, and urethra. Most infections involve the lower urinary tract, the bladder, and the urethra. Symptoms may include pain in your abdomen, pain in your lower back, pelvic pain, pain when urinating, urinary incontinence, frequent urge to urinate, fever, chills, cloudy looking urine, strong smelling urine, mental change in status such as confusion, fatigue, depression, anxiety, or stress. It's important to note that if you suspect your resident may be suffering from a UTI, report it immediately and fill out an observation report. Don't wait to have the nurse come check and assess the individual. If it's left untreated, it can become serious. They can get recurrent infections, permanent kidney damage, narrowing of the urethra, also known as urethral stricture, particularly in men, or sepsis, a life-threatening response to an infection. So remember, if you suspect any of these symptoms, be sure to fill out an observation report, notify the nurse, and make a notation in the residential logbook. Here are some prevention techniques we can practice as caregivers to ensure our individuals do not get UTIs. Ensure residents that toilet themselves, urinate often, and clean properly. Ensure the residents don't try to hold their urine for a long period of time. Avoid letting residents stay in a wet brief. Change a wet brief as soon as possible. Encourage good hygiene practices by prompting your residents to change into a fresh pair of underwear after exercising, swimming, or out in hot weather for a long period of time. Hydrate often, especially with water. If they don't like water, offer some watermelon or oranges as an alternative. They contain higher levels of water. This will help flush out harmful bacteria. And pay close attention to individuals with indwelling catheters. Clean thoroughly and often, as they tend to have UTIs more often than those who don't. So let's recap. It's important to know your residents and their normal routine. If you notice unusual behavior, fill out an observation report and give it to the nurse. If you suspect or notice symptoms that may lead to a possible infection, fill out an observation report and give to the nurse. Encourage your residents to practice good hygiene. When giving care to residents that need assistance, be sure to use good hygienic care. This concludes our monthly in-service on common infections. Thank you for your participation. Remember to take the CNA monthly in-service test and have your supervisor grade and return the test to staff development. If you have any questions, please call staff development at 267.